Hello everyone, very warm welcome to everybody joining today's session. Today we will be diving into an essential part of your FMGE preparation, one-liner questions and previous year questions PYQs in medicine. As you all know, medicine is a high-yield subject in FMGE and mastering these concise clinical questions will boost your accuracy and speed on the exam day. Our goal is in this session is to break down key one-liners and PYQs to help you understand not just the what but also the why. So you can confidently apply this knowledge in the exam and in clinical practice. Throughout the class, feel free to ask questions and interact actively. We will cover common topics, exam patterns, and provide explanations that will deepen your understanding. So let's get started and make your FMGE journey a bit easier and a lot more effective. Our very first one liner question is, what is the most common cause of community acquired pneumonia? The answer is Streptococcus pneumoniae. This gram positive coccus is the leading cause of lobar pneumonia, causing fever, cough, and chest pain. So moving on to the question number two, which condition presents with chest pain relieved by leaning forward? The answer is pericarditis. Inflammation of the pericardium causes sharp pleuritic pain, improved by sitting up and leaning forward. Moving on to the next question, what is the first line drug for managing acute myocardial infarction? So aspirin is the first line drug for managing acute MI. It inhibits platelet aggregation, reducing thrombus formation in acute coronary syndrome, aka ACS. Which electrolyte abnormality is associated with prolonged QT interval? The answer is hypokalemia. Low potassium levels disrupt cardiac repolarization, increasing risk of Torsades de Pointes. So moving on to the next question, we have, what is the most common cause of hypothyroidism? The answer is Graves' disease. Graves' disease is an autoimmune production of thyroid stimulating antibodies causing diffused goiter and thyrotoxicosis. So the next question is, which condition presents with polyuria, polydipsia, and weight loss? The answer is diabetes mellitus. Uncontrolled hypoglycemia leads to osmotic diuresis and dehydration. What is the drug of choice for generalized tonic-clonic seizures? The answer is sodium valproate. It stabilizes neuronal membranes, effective for primary generalized seizures. So the next question is, which organism is the most common cause of bacterial meningitis in adults? The answer is Streptococcus pneumoniae. It causes acute meningitis with fever, neck stiffness, and altered consciousness. So the next question is, what is the hallmark feature of Parkinson's disease? The answer is resting tremor. This 4 to 6 hertz tremor, often unilateral, is accompanied by bradykinesia and rigidity. Moving on to the next question, we have, which condition is associated with a positive Murphy's sign? The answer is acute polycystitis. Pain on palpation under the right costal margin during inspiration suggests gallbladder inflammation. So the next question is, what is the most common cause of peptic ulcer disease? The answer is Helicobacter pylori infection, H. pylori infection. This bacterium disrupts the gastric mucosa, leading to ulcer formation. Moving on to the next question, we have, which drug is used for rate control in atrial fibrillation? The answer is beta blockers such as metoprolol. They reduce heart rate by blocking sympathetic stimulation of the AV node. Moving on to the next question, we have, what is the most common cause of chronic kidney disease, CKD? The answer is diabetes mellitus. Diabetic nephropathy causes progressive renal damage due to chronic hyperglycemia. The next question is, which condition presents with cherry red spot in the retina? The answer is central retinal artery occlusion. Acute ischemia of the retina results in this fundoscopic finding. The next question is, what is the first line treatment for acute asthma exacerbation? The answer is inhaled salbutamol. This beta 2 agonist relieves bronchospasm rapidly in acute asthma. Moving on to the next question, we have, which virus is the most common cause of viral hepatitis in India? The answer is hepatitis B virus. It causes acute and chronic liver disease transmitted via blood or body fluids. The next question is, what is the characteristic ECG finding in acute pericarditis? The answer is diffused ST elevation. Widespread ST elevation with PR depression is seen due to pericardial inflammation. The next question is, which condition is associated with Osler's nodes and Janeway lesions? The answer is infective endocarditis. These peripheral signs result from septic emboli and immune complex deposition. What is the most common cause of Cushing syndrome? The answer is exogenous glucocorticoid use. Prolonged steroid therapy suppresses the HPA axis, causing Cushingoid features. The next question is, which condition condition presents with a positive tunnel sign at the wrist? The answer is carpal tunnel syndrome. Tingling on tapping the median nerve indicates nerve compression. Moving on to the next question, we have what is the drug of choice for severe malaria? The answer is artesunate. This anti-malarial rapidly clears Plasmodium falciparum parasitemoi. Which condition is associated with a positive Romberg sign? The answer is vitamin B12 deficiency. Subacute decombined degeneration causes loss of proprioception, leading to unsteadiness. The next question is what is the most common cause of acute pancreatitis? The answer is gallstones. Obstruction of the pancreatic duct by gallstones triggers inflammation. Moving on to the next question, we have which drug is used for acute gouty arthritis? The answer is colchicine. It inhibits microtubule polymerization, reducing neutrophil mediated inflammation. Next question is what is the hallmark feature of rheumatoid arthritis? The answer is symmetrical polyarthritis. Involvement of small joints, especially metacarpophalangeal joints and proximal interphalangeal PIP joints is characteristic. The next question is which condition presents with a positive cardiac sign? The answer is meningitis. Pain on knee extension with hip flexion indicates meningeal irritation. Moving on to the next question, we have what is the most common cause of secondary hypertension? Answer is renal artery stenosis. Narrowing of renal arteries causes renin mediated hypertension. Next question is which drug is used for hypertensive emergency? Answer is intravenous labetalol. It rapidly lowers BP by blocking alpha and beta receptors. The next question is what is the most common cause of Addison's disease in developing countries? The answer is TB, tuberculosis. Tuberculosis adrenalitis destroys adrenal glands, causing adrenal insufficiency. Which condition presents with a positive Chvostek sign? The answer is hypocalcemia. Facial muscle twitching on tapping the facial nerve indicates low calcium level. The next question is what is the first line treatment for type 2 diabetes mellitus? The answer is metformin. Metformin reduces hepatic glucose production and improves insulin sensitivity. Moving on to the next question, we have which organism is the most common cause of UTIs, urinary tract infections? The answer is Escherichia E. coli. This gram-negative bacillus is the leading cause of uncomplicated UTIs. The next question we have what is the characteristic finding of pulmonary edema? The answer is bilateral crackles. Fluid in alveoli causing inspiratory crackles often due to heart failure. The next question we have which condition is associated with a positive Gerber sign? Answer is Duchenne muscular dystrophy DMD. Weakness in proximal muscle causes difficulty rising from the floor. So we moving on to the next question we have what is the drug of choice for acute anaphylaxis? Then answer is intramuscular IMF-INF-D. It reverses bronchospasm and hypotension in allergic emergencies. Moving on to the next question we have which condition presents with a positive Schilling's test? The answer is pernicious anemia. This test confirms vitamin B12 malabsorption due to intrinsic factor deficiency. Moving on to the next question we have what is the most common cause of chronic liver disease in India? The answer is hepatitis B. Chronic HBV infection leads to cirrhosis and hepatocellular carcinoma. The next question we have which drug is used for rate control in ventricular tachycardia? The answer is amiodarone. It stabilizes cardiac rhythm by prolonging the action potential. The next question we have what is the hallmark feature of myasthenia gravis? There is fatigable muscle weakness. Autoantibodies against or acetylcholine receptors causes weakness and it worsens with activity. Moving on to the next question, we have which condition is associated with a positive straight leg raise test? The answer is lumbar disc herniation. Sciatic nerve compression causes radicular pain on leg elevation. The next question we have what is the most common cause of bacterial gastroenteritis? The answer is Campylobacter jejuni. This gram-negative bacillus causes bloody diarrhea, often from contaminated food. Moving on to the next question, we have which drug is used for acute pulmonary edema? The answer is furosemide. This loop diuretic reduces preload by promoting diuresis in heart failure. The next question we have what is the most common cause of hypercalcemia? The answer is primary hyperparathyroidism. Parathyroid adenoma causes elevated calcium and low phosphate levels. The next question we have which condition presents with a positive Kussmaul sign? The answer is constrictive pericarditis. Failure of jugular venous pressure to fall during inspiration indicates pericardial restriction. What is the first line treatment for TB, tuberculosis? Rifampicin, isoniazid, pyrazinamide, and ethambutol. You can remember this by via mnemonic RIPE. This four-drug regimen targets Mycobacterium TB for 2 months, followed by maintenance. Which condition is associated with a positive Babinski sign? Upper motor neuron lesion. Extensor plantar response indicates corticospinal tract damage. What is the most common cause of traveler's diarrhea? Enterotoxigenic E. coli. This bacterium produces toxins, cause watery diarrhea in travelers. Which drug is used for chronic heart failure? ACE inhibitors such as enalapril. They reduce afterload and improve survival in systolic heart failure. What is the hallmark feature of Guillain-Barré syndrome? Ascending paralysis. This post-infection demyelinating neuropathy causes symmetric weakness. Which condition presents with a positive Coombs test? Autoimmune hemolytic anemia. Antibodies against red cells causes hemolysis detected by this test. What is the most common cause of nephrotic syndrome in adults? The answer is membranous nephropathy. This glomerular disease causes heavy proteinuria and edema. Which drug is used for acute angle glaucoma? The answer is IV acetazolamide. It reduces intraocular pressure by decreasing aqueous humor production. Moving on to the next question, we have what is a characteristic finding in diabetic ketoacidosis? The answer is small breathing. Rapid deep respirations compensate for metabolic acidosis. Which condition is associated with a positive anti-CCB antibody? Rheumatoid arthritis. This specific antibody predicts erosive joint disease. What is the most common cause of subarachnoid hemorrhage? The answer is ruptured variant aneurysm. Secular aneurysms in the circle of Willis cause sudden severe headache. Which drug is used for acute ischemic stroke within 4.5 hours? The answer is alteplase. This thrombolytic restores cerebral blood flow if given early. What is the of multiple sclerosis? The answer is lesions separated in time and space. Demyelinating plaques cause varied neurological deficits. Which condition presents with a positive HAMS test? The answer is paroxysmal nocturnal hemoglobinuria. This test detects red cell susceptibility to complement mediated lysis. What is the most common cause of acute otitis media? The answer is Streptococcus pneumoniae. This bacterium causes ear pain, fever in children. Which drug is used for chronic obstructive pulmonary disease (COPD)? The answer is inhaled tiotropium. This long-acting anticholinergic improves airflow in COPD. What is a characteristic finding in acute glomerular nephritis? Hematuria with red cell cause. Glomerular inflammation often post streptococcal causes cola-colored urine. Which condition is associated with a positive Trendelenburg sign? Hip abductor weakness, pelvic drop on the unaffected side indicates gluteus medius dysfunction. What is the most common cause of viral meningitis? The answer is enteroviruses. These viruses causes aseptic meningitis with fever and headache. Which drug is used for acute gouty arthritis? The answer is indomethacin. This NSAID reduces inflammation and pain in acute gout flares. What is the hallmark feature of ankylosing spondylitis? The answer is sacroiliac joint involvement. Chronic inflammation causes low back pain and stiffness. Which condition presents with a positive Rovsing sign? The answer is acute appendicitis. Pain in the right lower quadrant on left side palpation suggests appendiceal inflammation. What is the most common cause of hypopituitarism? Pituitary adenoma. This benign tumor compresses pituitary tissue causing hormone deficiencies. Which drug is used for chronic hepatitis B? The answer is tenofovir. This nucleotide analog suppresses HPV replication. What is the characteristic finding in tension pneumothorax? The answer is tracheal deviation. Air trapping causes mediastinal shift and respiratory distress. Which condition is associated with a positive anti-double-stranded DNA antibody? The answer is SLE, systemic lupus erythematosus. This specific antibody is associated with lupus nephritis. What is the most common cause of diabetic foot infections? The answer is polymicrobial staphylococcus or streptococcus. Poor wound healing and nephropathy predisposed to mixed infections. Which drug is used for status epilepticus? The answer is IV lorazepam. It rapidly terminates seizures by enhancing GABA activity. What is the hallmark feature of temporal arteritis? The answer is jaw claudication. Vasculitis of the temporal artery causes pain on chewing and vision loss risk. Which condition presents with a positive drawer sign? The answer is anterior cruciate ligament injury. Laxity on anterior tibial pull indicates ACL tear. What is the most common cause of hemoptysis in developing countries? The answer is TB. Pulmonary TB causes cavity lesions leading to blood-streaked sputum. Which drug is used for acute decompensated heart failure? The answer is IV nitroglycerin. It reduces preload and relieves pulmonary congestion. What is the characteristic finding in Addison's disease? The answer is hyperpigmentation. Adrenal insufficiency increases ACTH stimulating melanocytes. Which condition is associated with a positive Shoger's test? Ankylosing spondylitis. Reduced lumbar flexion indicates spinal stiffness. Moving on to the next question, we have what is the most common cause of acute epiglottitis in children? The answer is Haemophilus influenza type B. This infection causes airway obstruction, now rare due to vaccination. Which drug is used for opioid overdose? The answer is naloxone. This opioid antagonist reverses respiratory depression. What is the hallmark feature of polycythemia vera? The answer is erythrocytosis. JAK2 mutation causes increased red cell production. Which condition presents with a positive Murphy sign? The answer is acute cholecystitis. Gallbladder inflammation causes pain on deep inspiration. Moving on to the next question, we have what is the most common cause of hyperaldosteronism? The answer is adrenal adenoma or Cohen's syndrome. Excessive aldosterone causes hypertension and hypokalemia. Which drug is used for acute bronchospasm in asthma? The answer is albuterol. This short-acting beta-2 agonist relieves airway obstruction. What is the characteristic finding in acute respiratory syndrome (ARDS)? Bilateral infiltrates on chest X-ray diffused alveolar damage causes known cardiogenic pulmonary edema. Which condition is associated with a positive anti-Jo1 antibody? The answer is polymyositis. This antibody is linked to inflammatory myopathies with lung involvement. What is the most common cause of chronic cough? The answer is GERD, gastroesophageal reflux disease. Acid reflux irritates the airway, causing persistent cough. Which drug is used for acute pancreatitis pain? The answer is meperidine. It relieves severe pain without causing sphincter or diaspasm. What is the hallmark feature of Wilson's disease? The answer is KF rings or Kessler pressure rings. Copper deposition in the cornea is diagnostic of this disorder. Which condition presents with a positive Hoover sign? The answer is COPD, chronic obstructive pulmonary disease. Paradoxical chest movement indicates diaphragmatic dysfunction. What is the most common cause of osteomyelitis in adults? The answer is Staph aureus. This bacterium infects bone often via hematogenous spread. Which drug is used for acute migraine with aura? The answer is sumatriptan. This triptan relieves vascular headache by serotonin receptor agonism. What is the characteristic finding in iron deficiency anemia? The answer is microcytic hyperchromic anemia. Low iron levels impair hemoglobin synthesis, causing small red cells. Which condition is associated with a positive Bairmets sign? The answer is multiple sclerosis. Electrical shock sensations on neck flexion indicate cervical demyelination. Moving on to the next question, we have what is the most common cause of deep vein thrombosis (DVT)? The answer is immobilization. Stasis from prolonged immobility promotes venous clot formation. Moving on to the next question for today, which drug is used for chronic gout? The answer is allopurinol. It reduces uric acid production by inhibiting xanthine oxidase. It's all about today. Thank you for watching and best of luck for your exam. Just focus on your preparation. You can do it.